Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
And you remember Johnny Carson when he used to? No, you don't.
Yeah, we'll
okay,
skip that.
today we're going to talk about after stroke. This one thing is key to rehabbing your arm and hand. And I've known this from working with stroke patients over my entire career, but it's also been verified now in some studies that I just read. So. Well, I'll tell you.
We're going to get to it.
I'm building suspense,
Okay,
Brad,
you're good at it, Bob.
Yeah. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, you'll want to go over to the Facebook and like us, Bob and Brad, because we are very soon starting giveaways where we're going to be doing one giveaway a week all the way up almost till Christmas.
7 weeks worth.
7 weeks worth. It's really going to be cool stuff you're really going to want to have.
There's excitement within the crowd, Bob.
We're going to send some positive vibes your way, too. You can become one of our good vibers. All right, so the one thing that they have found that the key to stroke rehab is that you have to have repetitive practice.
Sure.
Repetition, repetition, repetition. It's like practicing scales when learning a musical instrument.
Right.
You have to do it over and over and over again. And you're trying to reestablish those neural pathways.
Right.
So
they've gotten damaged, irritated, scrambled, if you will, and they need to find new ones or regenerate the old ones. And that takes time.
It takes time and repetition.
Yep.
So if you are, ideally, if you have some motion in the arm at all, you may even want to do a little bit what they call constraint-induced movement therapy. Okay. That's where they actually, you put like a mitt on your good hand, and so you can't use it.
Sure.
And you go through your day and you're forced to use the affected arm.
Right. Right.
But for a lot of us, though, when you start off, you may not have any movement or very little movement. Sure. And that's why we're going to talk about, there's a lot of things you can try, but I thought we'd talk about the CanDo wrist and forearm exerciser today. Sure. They sent this to us, and I was like, this is a good way to start with a patient who's had a stroke. You can start getting some movement. It doesn't take very much strength at all to get it moving. So what this kit comes with is, it comes with 3 half circles, basically. Is that what you call these?
Sphere? Would that be a hemisphere?
3 hemispheres.
There you go.
And they got 3 handles. Now the handles can go into any one of the devices. So, even though that's yellow on yellow, you can go the green on yellow, you can go the black on yellow. Right. And they're different sizes.
Diameters depend on your wrist or your grip activity.
So what you're going to start off with is generally first, if you're having any what we call tone, tightness in the arm, you're going to want to stretch out the arm first. And I know, a lot of times the typical pattern is sometimes your tone is more like this. Sure. And a lot of times we used to take the hand and just stretch it out like this. Yep. Stretch the elbow, the hand, and the fingers all at the same time.
Right. So the fingers oftentimes make that fist. We want to open the fingers up, work the wrist, and basically extension, what a therapist would refer to as extension, throughout the elbow, wrist, fingers, and hand.
And even if it's not real tight, even if it's just starting to get a little bit of tone, it's good to do that stretch first.
Yep, so, get things loosened up.
All right, so we're going to start off with, we're going to work a little bit on wrist flexion and extension, try to get some of that going. So, this one probably is the best one for that because it's so large. But you're going to start off, Brad's going to kind of show it from the side, and I'm going to show it the straight on view. So, again, you can almost even use your body to start getting some motion if you have very little on your arm yourself. If your arm is not working as well, you can even support it like this. Sure. And try to start. All you're trying to do is get some movement.
And you might take the other hand and go over the top.
Absolutely.
And you can let it help it out.
You can start with that, but try to do some without it too.
Yep.
And it's funny, you want to see that visual success. Sure. Because if you got kind of a dead hand or dead arm, you want to be able to see that, hey, I can make that move a little bit. Right. I don't care even if it's a little bit.
You get that feedback going.
Yeah, get that feedback loop going, and you want that encouragement.
Sure.
So this is, as Brad's showing, it's going to flexion and extension. And then you can also use the handle, and you can put the handle on. You're going to show it with the black one, Brad?
Yeah. You can use it with any one of these, depending on which one works better, what works handiest. And
And a lot of times, you know, even with you don't have much strength, you can just set the hand on there. And now you're going to work on flexion and extension this way.
So if you look at it from the top down, if we had our aerial camera, then you can see we're doing the same motion as this,
Yep.
but from a different angle.
And with a grip.
Right.
You know, so we're getting a little bit of finger grip there.
Yep.
Okay.
This way, you know, your thumb up, this way thumb side. It makes a big difference on how the body works.
Right.
So that's why we do two different motions.
This is almost probably a little more functional.
Right.
And that is what they have found with after stroke. The more functional activity you can do, the better off.
Sure.
It's better not to just work on individual motions if you can do full functional movements.
Sure. Right.
All right, so next one is supination and pronation. So this is working on the forearm, but so you're going to get on a flat surface here. And Brad, do you want to show from the side again?
Yep.
But I'm going this way and this way. So this is supination, this is pronation. You don't need to know that, but you're just going to go side to side like this.
And you'll find it's probably going to be much harder one way than the other. You know, you can, if you want to hold your hand on there.
Again, it's a starting point.
Right. But the goal is to get like Bob without the hand.
And a lot of times, again, if you're maybe in a seated position, you can be like this and you just, you know.
Sure.
It just doesn't take very much to move these at all.
Right. Yep. They're very free.
Now, again, you can do it with the handles on. These handles go in and go out very easy. Of course, now I made mine harder. All right. So now, now we're doing the handle. We're gripping this way, and now we're going back and forth this way. Again, very little motion it takes for this to happen.
You may want to find a little bolster. I have a roll here, and that kind of evens it out.
Excellent, Brad.
It's a nice little trick, if you will.
We got some patients who've had a stroke that I can't wait to try these on.
Sure.
I just got these, so I haven't even attempted this with them, but it's going to be a great activity with them.
Again, with this, you could hold with the other hand, or if as a someone helping or a therapist, if need to, you can start there just to get that motion going.
And do less and less as time goes on.
Right. The goal is to do it independently with one arm.
Or if your hand is even like this, you can just go like this.
Right.
You don't need to grasp.
Right.
So.
And it's amazing, once you start working with someone, and therapists know this, everyone's an individual, but you'll find little things that help that particular person out, whether it's visual, little assistance, how you talk about it.
So you can, if they're in a wheelchair even, you can set up a tray on their wheelchair.
Sure.
And they can just work on this for hours. I mean, maybe not hours, but you can work on it for 15 minutes.
Right, and then repeat it over the day.
Repeat it.
Every couple hours, every 3 hours, just get after it.
So next one we're going to do is we're back to this flat one again, and we're going to do radial deviation and ulnar deviation. So if you're looking at, from an aerial view, I'm going like this and like this. So we're getting the wrist moving back and forth. So we're getting a lot of hand movements, and we're also, when we did pronation, supination, we're getting some of the wrist motions too.
Right.
So, and these are the ones that tend to come back last. First you tend to get some shoulder motion, elbow and hand and wrist come out last.
Right, from the body down to the end, or we call it proximal to distal. You don't need to understand or know that necessarily.
And then once again, we can add the handle, and this way we're actually going to go, and you can probably get your bolster again then, Brad, or something.
Oh,
but
yeah.
You can actually work on going back and forth like this.
Right.
Ringing the bell, right?
Yep.
Or
ringing the bell, the maracas,
the maracas,
Yep. If you have any musical background and percussion, you know exactly. They look like a mushroom to me, Bob.
Yeah, they do.
Yep, that's kind of, something to think about someday, Then,
bong.
Oh, Bob, why, Bob, why?
All right, and by the way, they had sent us this one too, which this is a good one for does really one thing. It works on pronation and supination. By the way, these can be used after you've had hand surgery or
sure.
surgery.
Yeah, not just
stroke. Really good for that. But yeah, this is a very simple device, but it works really well. You just work on pronation and supination.
Here, let's put the bolster under there, Bob. I think that might be helpful. It's more comfortable.
Wow, that's fantastic. So I can just, it's very easy to do, but you can work on stretching it one direction.
You bet.
and stretching in the other
Right.
direction.
You know, and then you can give a little assistance very easily. Be nice. Don't overstretch.
So this is the we got links down below for these. This is the CanDo Pronation and Supination. It's $50. This is kind of a little pricey if you ask me. But,
right.
But this one I thought was actually a pretty good price, $75 for all three of these. So all three different.
Sure.
Where you got them over here?
Well, I was getting them out of the way for this, Bob. You know, he's got to make room.
We don't make anything off of these. We don't get an affiliate link. We have nothing to do with this. We just wanted to show you these, and
right.
We try to show you interesting products that are presented to us, and that's the case today.
You got a lots of words.
I did.
It happens.
It happens. Thanks everybody for watching.